Hello, anatomy friends. This is Dr. Alsop, and in this video, we are going to talk about the muscles of the abdomen. And we're going to start with talking about what bones there are associated with the abdominal region, and then we'll get into the muscles. So, kind of a trick question right off the bat in terms of what bones are going to be associated with the abdominal region. Well, obviously, if you're looking in the posterior region, you do have some of the vertebral column that is playing a role. So a little bit of the thoracic into the lumbar region will be protecting the posterior portions of the abdomen. But generally, when we think about the abdomen, we're thinking from a more anterior location, and there are no bones anteriorly. And there's a lot of viscera when you're talking about within the abdominal cavity. So what is protecting those structures? Well, it's muscles. And the muscles are organized in such a fashion that they are going to be running kind of in opposite directions, similar to what we had with the intercostal muscles, but a bit more robust than what we had with the intercostal muscles. So they're kind of organized almost like plywood to really help protect this region without the additional support of bone. So we're going to start with the muscles of the anterolateral abdominal wall, so kind of on the sides here. And generally, we think of these as our oblique muscles. There are two types of oblique muscles. There's the external oblique. As its name would suggest, it's more superficial. You can see that the direction of the fibers in this illustration here. You have the internal oblique muscles, which are intermediate in terms of depth. And then the deepest will be the transversus abdominis. So you can see fibers are going in different directions to provide that protection. Now, there are a few roles that these muscles can play. If you think of like an oblique crunch, that will play a role in terms of being able to do that. But really, its most important function is to help support and in certain situations compress the abdominal viscera. It's playing the role of protection. It's playing almost like a bone role in terms of that. So it's got to, when it contracts, it's to really just keep everything kind of in the right place. So these are the muscles that are going to be anterolateral. And their tendons, and we'll talk a little bit about this, are going to be very distinctive in the fact that these will be aponeuroses and will form this fairly prominent thing anteriorly, which is the rectus sheath. So again, an aponeurosis is just a name for a wide tendon. And that's exactly what's going on here. Those anterolateral abdominal wall muscles, their tendons will move anteriorly. They will split to enclose the anterior rectus abdominis. So you can see this here on the illustration. So well, let's first look at this image here. So the rectus sheath is very, it's rather opaque. It looks white in terms of that. Often what will happen with tendons. You can see that when you reflect the rectus sheath, you're looking at another muscle, which is not where the tendon comes from. The tendon, as you can see, is coming from those anterolateral abdominal muscles. So very, very prominent when looking at the anterior portion of the wall. And again, it will enclose the rectus abdominis. And right in the midline, those fibers from the tendons will really coalesce. They will become thicker. And this region is referred to as the linea alba. And you can see a rather prominent one here. It will extend all the way down towards the pubic symphysis region. And this is really just a midline raphe. Going along the middle here. So if thinking midline in the abdominal wall, you need to be thinking the linea alba. So we talked about that rectus sheath, and when you open up the rectus sheath, you have this rather long muscle that is within the rectus sheath region, and this is the rectus abdominis. Rectus just means straight. And again, one of the most prominent things about the rectus abdominis is that it is long. It extends all the way from the costal margin region, xiphoid process, down to the pubic symphysis. So it has quite a bit of an expanse to cover. It, similar to the anterolateral abdominal muscles, will play a role in terms of compression of that abdominal viscera. So again, protecting those deeper structures. It also, when contracting, can play a role in terms of flexing the waist. If you think of like a typical sit-up, these muscles are going to be activated. And another prominent thing that you can see in terms of the rectus abdominis are these tendinous intersections that you will find throughout. Typically, there are 3 pairs. Sometimes there is a 4th. And if these muscles, if the rectus abdominis muscles become hypertrophied, I'm having a hard time saying that. If they become hypertrophied, that can create, these tendinous intersections are creating that kind of 6-pack appearance, or an 8-pack in certain cases. All right, excellent. So, tremendously important area, but a rather simplistic area in terms of the amount of muscles that are present. So question here for review: an incision to the midline of the abdomen would most greatly affect which of these structures? Is it the external oblique or internal oblique, the linea alba, the rectus abdominis, or the transversus abdominis? So pause the video, and when you're ready, let's discuss this. Well, really, if I'm getting quite technical, an incision to the midline could affect any of these structures. But the answer I was going for, so it'd be most greatly, would be the linea alba, because that is right there in the midline of the abdomen associated with the rectus sheath. Now, if you have a disruption of the linea alba or the rectus sheath, that can certainly affect the muscles that create the rectus sheath. So those are the tendons of these anterolateral muscles. So that can affect the integrity of those muscles. The rectus abdominis is just deep within the rectus sheath. It's not right down the midline. It's generally right next to the midline or linea alba region, but it could be affected as well because that rectus sheath linea albus region is affected too. But really the answer I was going for here is that midline structure of the abdomen, and that is certainly the linea alba. All right, excellent. Thanks for thinking through this with me. If you have any questions regarding these muscles, please don't hesitate to ask. And if not, we're going to move into the upper limb. Thank you.